The biggest problem for kids with ADHD is that they're just being themselves, right? So what we try to do is to help the kid understand that, in fact, it it's not a disease, it's a difference. And they need to manage their difference in the same way as somebody who has some other kind of problem might need to manage their difference. And what we want to do is help them be successful in their lives. ADHD stands for Attention Deficit Hyperactivity Disorder. It refers to kids who have trouble in 4 areas. They have trouble with concentration, especially when the challenge or the task is difficult for them to pursue. The second area of difficulty is that they can be overactive, often with fidgeting. They get out of their seat in the classroom. The third area of difficulty is they're often challenged in organization. And then the fourth area of difficulty is that they have trouble regulating their emotions. They get upset about things that other kids don't get upset about. We tend to think that it's probably got a variety of causes, each unique in each child. Some families have ADHD in the family, so the dad has it or the mom has it and the kid has it. Some situations it's a reflection of prenatal exposure, perhaps to nicotine or alcohol. In some situations it arises purely by itself and nobody knows what causes it. Certainly if a kid has very low birth weight, either because of prematurity or because of failure to grow in the prenatal period, that kid is more likely. Kids who have been in orphanages overseas and are adopted into America, they're more likely to have difficulty. Kids who have other brain disorders, seizure disorder, tic disorder, are more likely to have ADHD. Kids who have metabolic diseases are more likely. What you're looking for is a persistent pattern of problematic behavior. You're looking for functional disturbance, in other words, interference with family life, peer relationships, and school performance. And you're looking for a pattern of behavior that sort of exists over time. What we try to teach parents is that they're not going to get the kids' attention by talking to their back while they're watching TV or playing video game or playing Legos and inviting them to dinner. It's just not going to happen. So we try to help the kid understand, help the family develop strategies that make things better, and then we use other treatments like medication when we need. So the main treatments for ADHD are a combination of family organization, family consistency, family rule setting, and family positivity, and psychopharmacology. The best medicines for ADHD are stimulant medications, either methylphenidate or dextroamphetamine. Oftentimes you see dramatic results with this once you hit the right dose. My approach to using medication in kids is to always use the lowest dose possible and then increase it depending on what you need. Well, the first thing is to check with the teacher and see how the child is in school. Second thing is to check with other people who are involved with the kid. Next thing is they talk to their pediatrician, right, or family doctor. Pediatrician, family doctor makes a diagnosis, recommends a treatment. They get to the right dose of the right medicine. The family organizes themselves. The teacher kind of chills a little bit, and everybody's happy. And then about 30 to 40% of the time, there are other difficulties at home. And in those situations, the family talks to the pediatrician and ought to get referred to me, right? Or another child psychiatrist who can prescribe medication, work with the family around their difficulties, and hopefully help everything be positive. Here at the Floating, our primary priority is taking care of families and patients and children. We're constantly learning, constantly working on keeping up with new developments in the field. We also have an ADHD clinic here, and that clinic has a senior child psychiatrist and a neuropsychologist who evaluate new patients with concerns about attention. And we do that through the life cycle. I want to help kids who are a little bit different feel normal. What I want to do is help kids grow and develop to their full potential.